Hi, everyone. I'm Deanna Bruce, and this is my podcast, Thrive to Learn. I'm excited to have you all join us, and even super thrilled to have my friend and client, Dr. Christina Paz, join us to talk about planning for the future. Dr. Paz, you are the Chief Executive Officer of Centro San Vicente. You're a community health center based in El Paso, Texas, and I'd love to hear more about the journey of Centro San Vicente and the roles that you play in leadership there.
Thank you, Diana, very much for having me on today. I'm excited to talk to you about Centro San Vicente, what we do here. It's an honor to be a part of this podcast, so thank you very much. And you couldn't have said it better. Centro San Vicente is a community healthcare center based in El Paso, Texas. We're one of three. Project Vida and La Fe are also here. But we are a very busy clinic. We have a main site, and then we have three other satellite sites.
Mm.
But typically, we see anywhere between 13 to 14,000 unduplicated patients a year. So you
It's a
add that
lot.
up into visits, and we're
Yeah.
talking about 44, anywhere between 36 and 44,000 visits a year. If you add in all the chronic disease management that we do here. We do primary care. We have pediatric care, dental, x-ray, behavioral health, pharmacy. The whole idea is to create a one-stop shop for our patients to be able to come to an area and get everything that they need for primary care under one roof. The other really fascinating thing about community healthcare centers or federally qualified healthcare centers like us is that we accept all patients regardless of their ability to pay. So that it's monumental for right now,
Yeah.
right? In the times that we're living. So a lot of people, unfortunately, are falling off of their health insurance because of the increase in premiums. But we are here to be their safety net. And El Paso is in dire need of primary health care. That is one of their biggest complaints is access to care. So we are honored to be able to provide that care for our community.
That's awesome. And you not only are chief executive officer, which means, you run the show,
Yes.
but you're also serve patients as a nurse practitioner. I think about empathy all the time when I work with my clients, and sometimes as leaders, we step so far away from our constituents that we can run the risk of losing sight. Like, I'm curious about how you think that serving clients, directly providing primary care in your nurse practitioner hat, how does that make you a better leader in the executive suite?
I'm in the trenches. I started here in 2009 as a staff nurse practitioner. So I've been here for a hot minute. And I was one of those nurse practitioners is like, why can't we do this for our patients? Why can't we do that? Can we write this grant? Can we not write that grant? And my predecessor, I think, was up to here with me and my request. But I mean, he was also, very well inundated at the time. He didn't have a chief operating officer. So the position opened up, and I went ahead and I applied. There was a lot of talent who applied right along with me, and I was blessed with the position. Maybe about 18 months later, Dr. Luna decided to go back to being staff physician, and I became
Mm.
interim. And then later, I was honored with the seat as being CEO. But through the course of all of that, I wasn't ready to give up patient care. Um, they're the reasons why I've stayed here for so long. They we need to be the voice for them, especially for those that don't have a voice. And I think that's really, Diana, what keeps me grounded is remembering every single time, every decision that we make, it always comes back to the patients. And we have 14,000 of them. So
Uh,
it's a lot of individuals that we need to think of to be their advocate, to be their voice, to make them healthy so that they can be able to provide for their families and have productive lives in the community.
mhm. Yeah, and what you said just made me think about uh, all the interviews I did. So in the process of doing, it's been such an honor to work with you and your team in developing your strategic plan to guide you over the next few years. And I listened to so many of your staff members. I interviewed so many as part of this process, and the passion and the love and the commitment that they have for the patient came out in every single interview that I did. And so when I think about what you're trying to do over the next few years, uh, how do you engage your staff? I'm sure you have more than 100 staff. That how do you engage them and make sure that they are on board with your mission and your vision and sort of are following that North Star that you're leading them towards?
So you ask a very good question, and that question is constantly at our strategy table. You're absolutely right. We have 210 employees. Online. We have 189 the last time I checked employees. And it is really hard to make sure that we have everybody on the boat together, right? It's like herding cats a lot of times. And empathy is a hard thing to sustain in this type of environment. It's not easy working at a federally qualified healthcare center.
Mm-mm.
So we do things around here like mission days. And we try to do those at least once, twice. At one point, we were doing them quarterly. And these mission days are exactly that, to bring all of our staff together and to remind them why we're working at a federally qualified healthcare center. What is our purpose? And that really seems to invigorate a lot of our employees. And so come Monday, they're ready to jump right back on the board again, to be able to serve in a compassionate way. We also have, what's very interesting in our dynamic is a mission integration officer. And her job is to make sure that no matter what decision we make, either at the management level, the director level, or at senior leadership level, that we're putting our mission first and we're putting our
Wow.
patients first.
Mhm.
And so she's always constantly redirecting us to make sure that our patients are at the tip of our tongue when we're making these decisions. And she also is there to provide that spiritual guidance to our employees in case that they find themselves a little lost in the and confusion into why it is that
Mhm.
we do this. She sits there and counsels them.
Mm.
Um, and sh Yeah, so that really, really does help, because you're absolutely right, Diana, that the trajectory in healthcare now is completely different. And so we're constantly having to shift now to make sure that we're providing the high quality care to our patients while assuming a lot of these other responsibilities that healthcare didn't have
Yeah,
before,
right.
and making sure that we're providing care for we're seeking our patients.
Mhm. Well, and your mission alignment work, I mean, you have such different types of patients. You've got the unhoused that you're serving through the Opportunity Center. You've got a rural community that you're serving in Socorro. You've got your 2 East Side locations serving the Mission Valley and the East Side on Pebble Hills. Like, when you think about developing a plan that meets the needs of everybody, like, what are you most excited for when you think about the next few years and the patients that you're serving?
You said it absolutely right. We've got a lot of wheels moving, a lot of components within our organization, and that's why we needed you. We needed you to help us herd those cats in, right? And
Right,
and
yes.
put them in a line, and that's exactly what you've done for us.
Aw,
So I
thank you.
couldn't be more grateful for the beautiful strategic plan that you have placed in front of us. It's clear, it's
Aw,
concise. We know
yay.
exactly where we're headed. And I think what makes me really excited about this entire plan that you help us put together is that they're goals that are attainable, they're meaningful, and they're gonna make a difference. And I think that's what makes me super excited about it.
Yay, that's awesome. That's so great to hear. That's my goal, right? I don't wanna give you a whole bunch of gobbledygook, just something clear and strategic. Oh, I'm thrilled for you.
No, it's
So
perfect. I mean, I could put numbers to it. All we
yeah,
need to do is find out where to extrapolate the data. So
uh-huh, right.
I'm really excited
Yeah.
about it.
Yay! That's awesome. Awesome. Well, thanks so much for being here. I want to close out our time with just 2 questions. One, what keeps you up at night? And I borrowed this from you. You
Gosh,
taught me this question.
yeah, I love these questions because they're brain teasers, right? What keeps me up
Yeah.
at night right now is really how to sustain a community healthcare clinic like ours, and this is not just me. This is CEOs from across the country that are
Mhm.
managing community healthcare centers. Where largely we were dependent on federal grants to sustain ourselves, we can no longer depend on grants.
Right.
So finding other ways to bring in revenue so that we can continue to pour that revenue into operations to continue
Mhm.
to complete our mission, I think
Mhm.
is what makes me toss and turn.
Yes. Yeah, it's what I hear from every CEO I talk to. And what makes you sing? What makes your heart sing?
Oh, there's a lot of things that thank God that make me sing. I have a 13-year-old and an 11-year-old, and watching them grow up makes my heart full.
Yeah.
They make me pull my hair out, but I love being a mama at the same time. And last night I was putting together my board report because we have board tomorrow. And I got to tell a story about a patient who was a board member here at Centro San Vicente at one point. And he's comfortable with me telling him his story. So I want to preface that. But he has been plagued with multiple sclerosis and it's advancing pretty rapidly. He likes to be outside. He likes to be social. He couldn't leave his house because his wheelchair wouldn't accommodate him leaving the house with, how most houses have steps that go up.
Yeah. Yeah.
We were able to get Texas Ramp Association to come in and build him a ramp.
Wow.
In his last consultation, he was emotional, telling me that now he can go visit his neighbors, and now he can go check the mail and not have somebody go do it for him. I just got chills. See, so those are the
Yes!
kinds of things that make me happy about working here at Centro San Vicente.
Wonderful, and I think I know the patient that you're talking about. I think I interviewed
Yes,
him
you
as part of the
do.
process. He's a very social man, and so the to the extent that this ramp can help him maintain his independence and his socializing with his neighbors, it's awesome.
Yes, you do know
Congratulations.
him. Thank you, thank you.
Congratulations. Well, I hope you enjoy the rest of your day, and I can't wait to keep following you on social media and the rest, and we'll make sure that everyone watching knows how to follow Centro San Vicente on its journey. So thank you
Please
so
do
much.
follow us on our social media sites, and those are very active sites. So we'll be happy to have all you guys as followers.
Yes. Great. Thanks, Dr. Fuss. Bye-bye.
Thank you. Bye bye.